Hi, good afternoon, and welcome to Courageous Journeys. Thank you for tuning in with me today on this beautiful autumn day. The mission of this program is to inform, empower, and inspire viewers to have courage to speak up against injustice, follow their hearts, and find ways to show love to all who share this journey of life with us. I am pleased to inform you that I have Dr. Delalas back with me today. He has 22 years of running his own private practice here in the Valley. We'll be discussing psychotherapy and what techniques are used to take patients from self-blame, self-hatred, and self-forgiveness to self-acceptance. So I'd like to welcome my guest, Dr. Delalas. Thank you so much for coming again. It's nice to have you. First of all, I would like Dr. Delalas, for those of you that perhaps don't know what psychotherapy is, to define that for us and then share with us who's actually legally able to practice psychotherapy and what you do with it.
Okay. Psychotherapy is a relationship-based treatment in which the therapist creates a structured relationship for the benefit of the patient to deal with emotional, behavioral, and relationship problems.
And so when you say it's relationship based, means that you're working to create a sense of trust and safety within that space, right?
Yes.
Okay. And then, Dr. Delalas, I noticed that a lot of people, walk around. We talk about taking them from shame and blame and all of this to having self-acceptance. Quite often, there are individuals that we either have to work with or have as family members that you feel like you're walking on eggshells on a regular basis because they internalize, they're taking everything personally. So I would assume that that has to do with their own.
Well, we are hardwired to learn from relationships. Okay. But we also each come into the world with a biological temperament. Okay. There are a number of systems that define the biological temperament, but the one I like has sort of four axes. Okay, one axis of harm avoidance.
Okay, so flight.
Well, some people are very harm adverse, and some people are not very harm adverse at all. Another axis is novelty seeking. Okay, some people like constantly going after new things, and other people like everything the same all of the time. Another axis is perseverance. Some people persevere regardless of frustration. Other people
Give up.
Give up easily. And I'm blocking right now on the fourth axis. But at any rate, so if you've got somebody, for instance, who is very, the fourth axis is reward dependence.
Okay.
That is, I mean, it's not like I need a cookie every time I do something, but it's more like relationship rewards. Some people are very independent and will do what they're going to do regardless. And other people need constant feedback. Okay, so if you've got somebody who is very harm averse and who is very reward dependent, then they're constantly looking for the next attack, but they're also looking for reassurance. And if they don't get the reassurance,
they feel insecure.
And the way we react to that is like the porcupine with the quills. You know, the quills of the porcupine are there to ward off a threatened attack or to end an actual attack. Okay? And a porcupine without its quills is lunch. You know, and it doesn't matter whether the attack is a bobcat that wants to eat them or a nearsighted elk that didn't see them there.
Right, they're still going to react out of
Right.
fear.
Yeah. And so a combination of inborn temperament and life experience can get somebody to the point where they're constantly waiting for the attack, and if something doesn't go as they expected, then they bristle.
Yeah, it doesn't go, that makes sense. I know recently there was an event where something didn't go as planned, and the individual got really agitated and started yelling for no particular reason, really.
For survival.
Yeah, for survival, yeah. In their mind, yeah, that makes sense. So over the 22 years of practicing, I'm sure you've seen and worked with many patients that have had a wide range of different areas that you've dealt with. Now, in psychotherapy, talk to us about some of those that would be.
Well, let's talk a little bit about what psychotherapy can do and what it can't do. Psychotherapy is the primary treatment for certain anxiety disorders.
Okay.
Primarily traumatic anxiety disorders, acute stress syndrome, what DSM calls Diagnostic and Statistical Manual of Mental Disorders, adjustment disorders, being overwhelmed by changes in your life.
Oh, okay.
Okay.
People that need the status quo constantly, and they have.
Well, anybody can be overwhelmed by the changes if the changes are big enough and come quickly enough.
Yeah.
Okay. And one of the changes that can cause that is health changes, physical health changes, a heart attack, a diagnosis of cancer, even a serious infectious illness. Okay.
That's life-threatening, so that feeling of threat again, right?
Yeah. And then the most severe of the stress anxiety disorders is post-traumatic stress disorder, which we certainly associate with combat, but it can also, a lot of people after a heart attack have PTSD, or a car crash or a mugging or whatever. And victims of child abuse can have lifelong PTSD.
I was reading about that, related to the child abuse.
Another anxiety disorder where psychotherapy is the primary intervention is obsessive compulsive disorder.
Oh.
Okay. And that seems to be a heavily biologically based illness that people inherit. But the best treatment we have is still psychotherapy, because one of our brain's primary function is to learn from experience to
So
keep
you're
us safe.
changing, I think I read that you're actually changing the way that they experience that, right, through practicing in your office.
Or homework.
Or homework. You send
that
them
they-
My workshop students don't like when I use the word homework.
Yeah, well, but everybody knows what it means. Okay. So then psychotherapy is also very effective in mood disorders, sometimes in combination with medication and sometimes by itself.
Right. Well, we had, as you know, previously on another program, we had discussions with regards to schizophrenia and bipolar. And in both of those, once you get the medications right, you still have so much baggage to clear out, right?
Psychotherapy is pretty hopeless by itself for treating schizophrenia or bipolar disorder.
Because of the chemical disorder.
And say attention deficit disorder needs a primary approach through pharmacology. But it leaves its emotional scars, which then can be helped with psychotherapy. Or psychotherapy can be very helpful in getting people to understand and accept their diagnosis and then accept the medical treatment.
Right, because a lot of people are in denial when they get that diagnosis, right? That's been my experience, So, okay.
And then relationship issues. Psychotherapy is very potent.
Relationships, parent-child, spouse, all of those types of relationships?
Yeah.
Sibling, the whole deal, any kind of relationship?
Yeah. Or early relationship trauma that then impairs how you function in adult relationships.
Right, because you have a trained way of response, and so you're trying to retrain that, or
Yeah.
help them retrain themselves, rather, right?
Yeah. Well, nobody gets a didactic course in how to be a human being. Okay. So we are programmed, biologically programmed, to learn from our early relationships what to expect we get acculturated by our relationships with our family. And if our family environment is significantly eccentric from the culture that we're growing up in, it's very hard to transition into that outside culture because we're constantly expecting the culture that we grew up in our childhood home.
To have the same kind of response in the outside world. Same thing with regards to, and we'll talk about that when we come back, we're getting ready to break, but as far as a child's response to abuse and how they deal with that. So thank you for tuning in. We'll be right back in a moment, right after these commercials.
If you've got something to say and you'd like a place to say it, check out centralvalleytalk.com. We are interviewing for new talk show hosts at this time. If you'd like to advertise on centralvalleytalk.com, go to our website and it'll tell you what to do. centralvalleytalk.com.
The hunt to quench your thirst is on. Ecolo Blue is a revolutionary atmospheric water generator, producing water straight from the air, up to 8 gallons a day at 20 cents per gallon with no additional hookup required. Ecolo Blue is the clear champion of the water solution revolution. To health, to purity, to the pursuit. Ecolo Blue.
Hi, Stan Gross of Horn Photo. Are you looking for a camera that takes better pictures than your phone? Why not give Horn Photo a shot? We can show you fantastic cameras from Nikon, Canon, Sony, and GoPro. Your time is valuable, so before you buy from Costco, Best Buy, or the internet, come see us. We've got great prices and deals, super knowledgeable staff, and we've been selling cameras in Fresno for 76 years. We're in the Bellagio at Blackstone and Nees, or go to hornphoto.com, Fresno's Camera Center.
Own it all at Onacar, Fresno.
Ag is a vital part of the economy here in the Central Valley. Hi, I'm Ty Simpson, sales manager of the new Bland Solar office here in Clovis. And if you're in the ag industry, you've probably given thought to solar. Whether you run a dairy, orchard, farm, or ranch, at Bland Solar, we can custom design a system that's perfect for your business. The fact is that in this economy, replacing high-cost utility power with solar power is a great way to improve your bottom line. Bland Solar looks forward to serving the residents of the Central Valley. So call us today at 554-5657. Bland Solar, the Valley's expert in solar.
So why switch to Dish?
With Dish, you get more options, you get more value, you get more channels. With Dish, you get more.
And now you get more for less. Save up to $872 in just your first year with our best deal ever. With promotional prices starting at just $19.99 a month for 12 months.
We've gotten better quality, better customer service.
And now you can even get HD channels free for life.
We are Dish customers for life. We love Dish.
This is our best deal ever. Call now to switch to Dish.
For all of your real estate needs, call Mike Briggs Properties, 559-486-6758, or check us out at MikeBriggsProperties.com.
CentralValleyTalk.com.
Hi, welcome back to Courageous Journeys, and I am here with Dr. Delalas, and we are discussing psychotherapy. And before we cut for the commercial, Dr. Delalas, We did not cover who is actually licensed and has the ability to practice psychotherapy legally with you.
Yeah.
So,
There are 4 licenses in the state of California. Psychiatrist is a medical doctor who has specialty training in diseases of the brain. And for the last 5 years, in order to finish an accredited residency program in psychiatry, you have to demonstrate competency in 4 different forms of psychotherapy.
okay.
Then there are licensed psychologists, clinical psychologists. They have a PhD, which is a non-medical degree. In Fresno, we have at least 2 programs offering PhDs, one at Fresno State and one at Alliant University, which used to be known as California School of Professional Psychology.
Okay.
Okay. Then,
Can I ask you a question about that, though,
Yeah.
before you proceed? So for that particular degree, though, they are not able to prescribe medications, correct?
right.
Okay. Just want to clarify that.
Psychiatrist is the only mental health degree
Right.
that can prescribe medication.
Okay.
Okay. Then there is a licensed clinical social worker who is somebody who has at least a master's degree in social work, and then goes on sort of a subspecialty of social work to clinical work, psychotherapy, counseling, that sort of thing. And then there is marriage and family
I was
therapist,
going to say, okay.
which used to have a 4-letter designation, and I don't remember what they...
The acronym, don't you love that?
Yeah. But they're now MFTs, okay? And they need a master's degree in a counseling-related field.
Okay.
But it can be a very broad spectrum. It can be clinical pastoral counseling, it can be psychology, it can be social work, it can be rehabilitation counseling, it can be criminology.
Wide range, yeah. it's
Wide
good.
range.
So then how do they then narrow it down to be able to do that, and what are their limitations?
Okay. They need, I don't know all
Okay,
of the
okay.
licensure, but they have to have specific credits, and then they have to take an examination. All of these 4 degrees have to take a state examination
For licensing.
for licensing. There is no good evidence that any one license or letters after your name makes you a better psychotherapist than any other. Okay. So it's more the individual. And all psychotherapy research has shown that some individuals are superior to other individuals.
Well, you mentioned relationship building, and I would be under the impression, and through my own experiences, that it really is quite often about how comfortable the 2 individuals feel with one another,
Yes.
right? And body chemistry and everything else will make someone react in one way, regardless of the discussion that's going
Well,
on.
there is probably no psychotherapist who is the best therapist for everybody. And maybe not even any psychotherapist who is the best therapist for a given individual at every stage.
Right. They can transition. So let's get into the meat of some of the different situations. And first of all, if you wouldn't mind, I'd like to talk about children and how they end up reacting in situations of abuse that might not be what you would assume.
Well,
there was a
children is
study-
not my specialty
Oh, that's
area.
right. That's right.
Okay.
Adults, though.
But I think you're referring to Harlow and his
Yes.
monkeys. Okay. Well, there was a famous child psychiatrist by the name of Winnicott, and I forget his first name, who observed that there is no such thing as an infant. There are mother-infant pairs, but infants can't exist on their own. Okay. So one of the jobs of the infant is to attach to
the
the parent.
caregiver or the parent.
Yeah. And this can be easier or harder depending on the match of the temperaments, the environment that it's happening in, and, for lack of a better term, the neuroses of the mother. Okay, and I'm going to use the term mother generically.
Right.
A primary caregiver.
Yeah.
But a couple of things from Harlow. Harry Harlow was a psychologist working at the University of Wisconsin in the 50s. And as his primary subjects, he used monkeys. And one of the things he did, which is not what you're thinking about, we'll get to that,
Okay.
is he looked at what he found were therapist mothers, he called them,
Okay.
who were mothers who were very comfortable in what they did, they were very tolerant, and then there were more anxious mothers, and he could take an anxious child of an anxious mother and
Put it with the calm, secure
put it with
one.
the calm mother, and it would have a better outcome than a similar infant raised by its biological mother who was anxious. Okay. So then the other thing he did, which PETA would never allow him to get away with today, was he would take away the infant from the mother and put it with non-biological substitute
Right, he created a
mothers.
wire one and one with a soft coating and,
Right. One of the theories back then was that attachment was all about learning from feeding. And then you learn to attach to the mother because you breastfed.
okay.
And one of the things he proved is that that's not true. And with these, the wire mesh mother with baby bottles full of milk and a terry cloth mother with no feeding apparatus. And the infant monkeys would go to the wire mesh mother and feed and then come back
Jump
and
over
cling.
for the comfort, right.
Okay. And so then he tested this by hooking up devices to discourage the infant from
The terry
clinging.
cloth mother.
Right, and one of the devices was to hit the infant in the face with a jet of compressed air, which is a terribly noxious stimuli. And surprisingly, what he found was that the terry cloth, that the infant clung more dearly to the terry cloth mother despite the discouraging stimuli.
Right.
And this seemed to be because it is at precisely the times that you are the most stressed that you need the most comfort. And if your primary comforter is also the individual who is stressing
inflicting the
you,
stress.
it cements the bonds. And this is why it seems to be that abused women or abused spouses find it so hard to separate from the abusive spouse, because it's almost like abuse and comfort versus alienation and
and the
isolation.
unknown and isolation.
Yeah. And we often see in abused children that the abusive parent is also the one who pays the most attention to them, and the other parent can be very passive and emotionally unavailable. And so the child is clinging to the abusive parent.
And a sign of that, quite often, wouldn't you say, is like when the child is afraid of leaving the side of that parent and, you know, almost frightened of everything outside of.
Yeah. I wouldn't push that too far,
Okay.
because there can be other situations which will cause a clingy child.
Yeah, well, I'm sure there's a lot of situations.
Yeah.
So in taking an adult, and that's your specialty, let's get into the meat of that and discuss the development that we end up doing to ourselves as far as blaming ourselves, and that's been going on, you mentioned, since the beginning of time, pretty much, even
Yeah.
from, biblical times on. And then turning that into self-hatred, and how you take the individuals from that.
Okay. Well, there are, I think, two primary mechanisms of why we blame ourselves. And one is the blaming the victim. That is, if the victim did something to bring the disaster on themselves, then, and I don't do that, then I'm safe. But if the disaster's coming on me, if I'm completely innocent and this is still happening, then I'm helpless. I can't do anything to save myself. But if this is happening because I did something wrong or I'm not doing my best, then there's something I can correct.
Right. So it's a more secure place to be. So
Right. It's better to be bad and be able to do something about it than it is to be good and helpless.
And so, so individuals who are being abused quite often then will turn it around and blame themselves that I could have been better, I could have been prettier, I could have been something, right, to not have
Right.
this situation.
And often the abuser cooperates with that
Oh, I'm
because
sure.
they're blaming.
And now they're not to blame
Right. Yeah.
for that situation.
And one place where you see that is in drug-addicted or alcoholic parents who aren't going to take responsibility. And so that 40 years ago brought up the movement of ACA, Adult Children of Alcoholics, who have this common experience and developed a 12-step movement to deal with that.
You know, I don't know if you've seen it, but I found something kind of interesting online was Adult Children of Hippies.
Okay, no,
And
I
all
haven't
of the
seen that.
different, it's interesting, someone did a documentary on it and how they react, but we won't go there. But so talk to us about the exposure therapy and how that helps you
Okay. Well,
or helps them.
yeah. I see the therapy that I do in this situation as relationship exposure therapy. Okay. Exposure therapy is a form of psychotherapy that was first worked out for specific phobias.
Phobias, right.
Okay. So if we take, say, phobia of a spider, fear of a spider, you start off having the person say, write down the word spider over and over again until they can do it with minimal or no anxiety. And then you have them deal with, say, a drawing of a spider and confronting them with that until the anxiety abates. And then a photograph of a spider, then a video of a spider, then a live spider behind glass.
So in a sense, acclimatizing them to that
Right.
through repeated safe
Yeah,
experiences.
exposure to the feared object in the presence of
Yeah.
safety.
So in relationship exposure therapy, talk to us about you're having them discuss what the incident was.
Well, when I engage the patient in a relationship, we develop material in two ways. Okay. One way is that they're going to behave in the relationship with me the same way they behave in all of their relationships. So we get to see their assumptions about themselves and others in a practical setting. Then I'm also asking them questions and getting their story, and then I can develop information that they've been hiding from themselves. And so as I see them in that setting and feed it back to them, they get exposed to hidden parts of themselves.
Because you're not emotionally attached, you can see from the outside how they're relating to a situation or what might be why they are doing that.
Yes.
And then you regurgitate or tell them back what
Right.
your observations are.
Yeah.
Okay. And in your notes to me, you mentioned that in doing that, your consistency, that you're constantly consistent in that process.
Yeah.
And therefore that also gives them a sense of they know what to expect, right? Predictability,
Yes.
which makes them feel safer.
Yes.
Okay. What else does it do? Tell our guests.
Okay. It allows them to take the therapy outside of the session. That when they know what kind of questions I'm going to ask, what kinds of behaviors or thoughts or feelings that I'm going to be interested in, then they start asking themselves those same questions between sessions.
So, for instance, if it were somebody who gets agitated easily, they would say to themselves, what is it about this situation that's
Right.
making me feel nervous or
What am
upset?
I feeling?
Right.
What's my feeling about? What do I want to do about it?
Okay, are those the three? I don't, say it again.
What am I feeling? What is my feeling about? And what do I want
to do about it?
Not what should I do about it, but what do I want to do about
So
it.
what's the difference between, because obviously there is a key difference between should and want.
Well, should is an obligation to the outside. Want is
for you.
paying attention to yourself.
Okay. So talk a little bit about that process, because I know you had some other things that you wanted to cover in that before we cut for break.
Okay. That
Did I get you off?
yeah, the cut for break.
Okay, sorry. So in the exposure relationship there.
Okay. I'm paying attention to what the patient is saying and how they're saying. Okay. And a big part of all of our communication takes place on a nonverbal level. Okay, so that as you're listening to my words and forming intellectual understanding, you're also paying attention to my tone of voice, my facial expression,
Body language.
all of that. And, by paying attention to the nonverbal communication, the exact same words can be information, can be a question, can be a joke, can be a threat.
Right.
By the accompanying nonverbal communication. So, when I am paying attention to the patient, I am, as it were, listening with 3 ears. Okay. I'm listening with a curious, naive ear. Okay. What's this story about? I want to ask questions so I'm sure that I know what you're talking about, and so that I know that you know what you're talking about.
Right,
So,
right.
I
So
want to
there's a
avoid
dialogue.
labels. I want to avoid jargon, that sort of thing. Then I'm listening with a historic ear. I want to know what you're saying to me now, how that fits into everything you've told me
In the
before.
past.
Yeah.
Okay.
And if I see patterns in that, I want to reflect that back to you. If I see contradictions, I want to understand why what you're telling me now seems to be different from
Than
what...
in the past.
Right.
Okay.
Okay. And then I'm listening with a theoretical ear.
Okay, we're going to talk about the theoretical ear in just a minute, and I have some questions on the other two too. So we'll be right back after this.
Okay.
I'm Mike Briggs, owner and CEO at CentralValleyTalk.com. If you like talk radio, you'll love CentralValleyTalk.com. All local, all live, all the time, CentralValleyTalk.com.
Have you seen a house for sale in the Tower District that you might like to own? It doesn't matter what realtor in town is selling it. If you like it, check it out at TowerDistrictProperties.com.
I'm Christopher Bundros. I'm a CPA in Clovis. People come to me who haven't filed their taxes in quite a while, or when they do file their tax returns, they're surprised by how much taxes they owe. Or when tax season comes along, their records are so disorganized they have no idea what their income or expenses are. Call me at 559-765-0313 to arrange a complimentary 30-minute needs assessment. You can also find me on the web at clovisaccounting.com.
If you have a pet, a horse, a dog, or a giant tortoise, sooner or later, you're going to have to scoop the poo.
Scoop the poo, scoop the poo, scoop the poo, take care of you. What you don't want to do, scoop the poo will do for you.
Hello, Hello, I'm Shelly at Horn Photo, and it's time to do more with your pictures. Get those images out of your camera, off your computer, and rescued from deep within your phone, and turn them into memorable photo keepsakes and gifts. Here at Horn Photo in Fresno, we have many wonderful photo items that we produce in-house, and we're here to help you find your individual style. So now's the time. Stop by Horn Photo in the Bellagio at Blackstone and East, or visit us online at hornphoto.com to explore the possibilities.
Hey, everybody, let's have some fun. You only live once, and when you're dead, you're done. So let the good times roll. Let the good times roll. Let the good times roll.
Watch Mike and Athena Fridays at 1 p.m. on CentralValleyTalk.com.
So why switch to Dish?
With Dish, you get more options, you get more value, you get more channels. With Dish, you get more.
And now you get more for less. Save up to $872 in just your first year with our best deal ever. With promotional prices starting at just $19.99 a month for 12 months.
We've gotten better quality, better customer service.
And now you can even get HD channels free for life.
We are Dish customers for life. We love Dish.
This is our best deal ever. Call now to switch to Dish.
For all of your real estate needs, call Mike Briggs Properties, 559-486-6758, or check us out at MikeBriggsProperties.com.
CentralValleyTalk.com. Hi, okay, welcome back. We are talking psychotherapy with Dr. Delalis, and he was talking about how he listens with the 3 ears. So I apologize for cutting you off, but if the first two that you mentioned were listening with curiosity, naive curiosity, to learn about the situation or events that took place. And then the second one was historical. So
the patient's history. We're not going back to the revolution.
the patient's history and what they've already told you, and kind of keeping track of that and going back and see if they change it and have inconsistencies. And
or patterns.
Or patterns of behavior?
Behaviors, thoughts, feelings.
Okay. And so then when you're doing that, at that point that you notice patterns, are you also then sharing your observations with the patient? Okay.
Yeah. I mean, the patient is the unimpeachable authority on themselves. Okay.
I like that.
And so I'm a student and they're teaching me.
I'm going to use that line. I'm the unimpeachable authority on myself. Okay. And they're teaching you about themselves.
Right. Yeah. And I have emotional distance from their life. Mm-hmm. So I can see their blind spots. Mm-hmm. Things that are too painful, things that are too frightening, off limits for whatever reason.
Well, I have another question related to that particular sense that you just said, but tell us about the third ear, and then I'll ask you that.
Okay, the third ear is the theoretical ear. Okay. There are dozens of psychological theories, and none is proven to be the correct theory or the best theory.
It's a science, right? So it's constantly you're experimenting.
Well, and it's very complicated. The brain is the most complicated structure in the known universe. We have on the order of 100 billion, with a B, nerve cells. Each of those nerve cells, on average, is connected to 3,000 other nerve cells. And the vast majority of those connections happen in response to experience. They're not genetically programmed. Okay, so everybody is different, and that's why I need to find out from you where you're coming from. But the theory tells me it's a topographical map of psychology. And so when I initially meet with somebody, I do a diagnostic interview before we start any kind of therapy.
And they have a big questionnaire that they go over, right?
Right. And so I place the patient here on the topographical map of my theory.
Okay.
And then that theory tells me what I am allowed to do with this particular person, with this particular problem at this stage
Of the progress,
development.
yeah.
And that tells me how I can be a therapist. Because when I find myself doing things that I'm not supposed to do by my theory, then I know I'm not doing therapy.
Because of, oh, okay, okay.
Okay? That I am responding to the patient's emotional cues and avoiding their problems, or I'm...
Or you might be triggered by something, right?
Right, okay. And so, you know, if I don't have a theory, if I don't develop a set of rules for what I can do, then therapy isn't happening. And not only am I not helping the patient, but potentially I can hurt the patient by overstepping the boundaries.
Right. So when you had mentioned a moment ago when we were on how when you ask them something and something could be triggered as far as memories and whatnot, or you can see from the outside what was happening. Now I'll tell you from my own personal experience that the conscious mind so often will bury those experiences to protect itself, right, from the pain of that. So if those haven't come to the conscious mind, is there any way, I mean, what kind of things would make you come to that theory?
Some theories say that the work of psychotherapy is to uncover the past. Okay. The way I work is that the past is present right here. I'm working on the relationship. And so you're relating to me the way that you learned to relate to other people. Okay? And so I don't need to know what happened back then, although it may come up and I'm not going to tell you not to remember it. But by looking at how you relate to me and finding out what I'm doing that's triggering your relationship to me.
So if I get agitated with you, if you've asked a particular question and it seems
Well, let me give you a specific thing.
Please do.
I was working with a patient, and I've been working with her for quite some time, and she was telling me this story of what had been happening, and all of a sudden, she just fell completely silent, and she just looked down at her lap. Okay.
Body language.
I have no idea what happened.
Okay.
Okay. Over the next 4 or 5 sessions, we were able to work out that as I was listening to her, I inadvertently looked down at my fingernails. Okay. This was the sign from her father that he was done with her.
Oh.
Our conversation...
So that triggered her response.
Yeah, I had just rejected her. I had just abandoned her.
Wow.
Okay. And so that's, you know, this whole nonverbal communication. And the fact that I am going to do these things doesn't mean that I mean the same thing.
Right.
As
So in order to discover that that was the reason for that, did you say to her, so what happened just now? Or
Right.
Okay.
Yeah. But initially, she was so frozen by shame
Wow.
that she couldn't
baby.
respond.
Yeah.
Okay. But we were able, because I had been consistent up till that point, and because I didn't get defensive or accusatory
Right.
or
any
whatever.
of the rest of it that came along with Dad, she.
Right. And therefore, you know, we can work through that. And she was therefore exposed to this shame trigger. And it didn't destroy our relationship. She didn't get punished. She didn't get abandoned. And so, you know, I didn't have to go back and repeatedly look at my fingernails, which, if I had, may have destroyed the relationship. But we were able to look at that level of insecurity. And by repeatedly exposing the patient to herself in the context of our relationship, that I saw a part of her which she wanted to keep hidden. And she knew I saw that part of her, and nothing bad happened, that eased the anxiety associated with that
Right,
rejected
and to be able to
thought.
open up more about what
Right.
actually happened during that.
Yeah, and so it needs to be done repeatedly because the emotions are so strong, and then you gradually increase the breadth and the depth of the patient's exposure, and the more they can do that in their relationship with me, then they can begin to take that outside the therapeutic relationship and try it in other
Right, start using the
relationships.
skills that you taught them to think about, question themselves, like we mentioned earlier.
Right.
So, as far as your primary tool, you mentioned that predictability allows them to do that. Is there any particular technique that you use to help build that self-confidence other than the predictability?
Well, one of the most important things I do is I listen to the patient. I pay attention. So many of the people who come to see me can only get attention by taking care of the other person. Okay? Now I'm not telling them anything about myself. I'm not telling them what my expectations are. I'm making it very difficult for them to take care of me.
Okay.
Okay? And I'm attending to them,
Right.
which can be very frightening, very threatening, but it is also desirable because we all need that.
Right.
We all need
Yeah.
to be the center of attention at some point, but many of us have been taught not to, because when you're the center of attention, you get hit
Right.
or criticized or,
Or sexually molested or whatever, right?
yeah.
Um,
And so just paying attention, for this 45 minutes, you are the center of the universe.
during the session.
Yeah, that in itself is a powerful tool. And then the other tools are to ask questions, okay? Questions empower you. Again, you're the teacher, I'm the student, okay? Now, sometimes I may interpret things. I may interpret that when you're telling me that you were angry, I may interpret that you were hurt by the other person and that's why you were angry. You know, so I'm interpreting the emotion that's not being shown.
Right, and also, for instance, like the feeling of abandonment, quite often then other things happen to the child or the adult because of the abandonment of the caregiver,
Yeah.
that then they turn around that pain into anger against that individual, right? Because they didn't do the caregiving, right?
Right.
So let's talk about that a little bit, if you don't mind. So when you have adults coming to you and they might not really understand that whole particular thing that's causing them to be so angry. I think most of them probably do, but I don't know.
Well, yes and no. So that we're constantly looking at what happened, develop a chronological story, and looking at the patient's internal experience at points that seem to be important to
Okay.
me, and their emotional responses and their motivations. But, you know, they'll initially come in and they'll be talking about the other person or the situation, and then I'm going to reflect it back and get them looking at themselves
Right.
and involved.
And how they were involved and how they feel about it and all of that.
Right.
Okay.
Yeah.
I wish we could have a call-in, but I know we're not doing that today. What would you like to share with, is there any more of that process that you'd like to discuss, or?
Well, as the patient gets more and more accepting of themselves, then if we go back to the original motivation, that is, I blame myself to gain control. Now if I find out that I didn't bring this on myself, then there's who caused it.
Right, right.
Okay, and at this stage, there is often anger the other. But this creates a conflict, because if I am dependent on that person, and I've grown up my whole life believing that I'm dependent, and I'm now blaming them for what happened to me, they're not who they seem to be. And so there is this tremendous loss of the idealized other.
Right.
Okay? And sometimes that idealized other is parent, and sometimes that idealized other is God. And so there can be a spiritual crisis.
Yeah, and a lot of people get angry with God, and then they become bitter, and that's kind of a vicious cycle if they don't have help too.
Yeah, yeah. And so at that point, rather than sort of working on the patient and themselves, then we begin the grief process.
Okay.
That's the loss of the idealized other.
Yeah. I don't think I covered that part. That makes sense. That makes a lot of sense, because you're feeling that now you're all alone, that you've really lost them, but they're still around.
Right, yeah. And, you know, when we are ultimately successful, we have a patient who experiences themselves as a flawed but acceptable human being.
Okay.
And the other as a flawed but acceptable human being.
Able to love them and themselves with their flaws.
Right. Yeah. Now, sometimes they find they can't stay with the other. And it may mean breaking off relationships with family of origin. It may mean a divorce.
Right, right.
Some such thing.
Well, and in trying to navigate those murky waters of relationships, for me, at one point in my life, I found that it was necessary, just because of the level of healing or getting through those issues. You're not all going at the same levels. And so sometimes conversations are just totally non-productive. And there does come a point where you have to just draw the line and say, you know, I love you, but this isn't going anywhere positive, and I'll talk to you later, whatever,
Well,
until they learn that you're not going to have that button pushed.
And
too.
coming to the realization that there's no way you can change anybody
You can't
but
fix
yourself.
it, yeah. Yeah.
So you either take them on their terms, or you let them go. But the other part of that is hanging on to yourself in the presence of this other person.
Maintaining your own.
Yeah, your own boundaries, paying attention to what you want, why you are there for you, not why you're there for the
them.
other person.
Okay. I wanted to share some exciting news with all of you that I forgot to do in the very beginning, and that was that I don't know if any of you have had a chance to attend the La Comida Guild home tour, which happens every year in the winter, and it's a fundraiser for Children's Hospital. And we actually had somebody donate a ticket to the evening preview, which is $150 value. And so on the next program, we're going to have the lines open so that you can bid on that and see if you will be able to attend with us. So we only have a few minutes left, and there's a lot of area that we didn't have a chance to talk to. So I would like to cut for just 1 minute, if you wouldn't mind, and we will be right back.
I'm Mike Briggs, owner and CEO at CentralValleyTalk.com. If you like talk radio, you'll love CentralValleyTalk.com. All local, all live, all the time, CentralValleyTalk.com.
Have you seen a house for sale in the Tower District that you might like to own? It doesn't matter what realtor in town is selling it. If you like it, check it out at TowerDistrictProperties.com.
I'm Christopher Bundros. I'm a CPA in Clovis. People come to me who haven't filed their taxes in quite a while, or when they do file their tax returns, they're surprised by how much taxes they owe. Or when tax season comes along, their records are so disorganized they have no idea what their income or expenses are. Call me at 559-765-0313.
Hi. Okay, so we were talking about the grieving process. Now, obviously, not everybody has medical insurance or can afford necessarily different forms of therapy. So what kind of resources are out there that you might
Okay. For formal psychotherapy, the University of California, San Francisco Central Valley Extension, which is down here by Fresno Community Hospital,
Okay.
has a residence clinic with a very good sliding scale for doing psychotherapy. Alliant University, which is on that extension where Clinton turns into Peach
Oh, yeah. I
over
hate
by
that
the
area.
airport,
Yeah.
they have a trainee clinic with a sliding scale.
So individuals can actually talk to a therapist who's in the training process, the licensing process, right?
Another thing are self-help groups, okay? The National Alliance for the Mentally Ill has a patient-to-patient and a family-to-family support groups. There is another organization called the Bipolar Depression Support Alliance, which is an interdenominational peer support group. There are, of course, 12-step programs if chemical dependency is part of the issue, either for the chemically dependent person or for the families.
For the family.
With Al-Anon, Narcanon, CODA, Codependence Anonymous, Adult Children of Alcoholics. And then there is this whole other area of online support. There are actually some free websites that have interactive cognitive behavioral therapy.
Interesting.
And then there are chat groups.
Right. So on the chat group, then the psychiatrist would be responding to the questions?
No, most of those are peer-to-peer.
Peer-to-peer, oh.
Yeah.
So you never know how that's going to go.
But one of the things that those do is, because psychotherapy is complicated, there are so many people, different people out there doing it, the best way to find somebody is find somebody you trust who knows somebody, and those
Right.
chat groups are a resource for
Right,
that.
through a referral, through a
Yeah.
relationship. Well, it's fascinating always having you on, Dr. Delalas, and we could go on, but we appreciate you taking an hour out of your day and tuning in with us today for Courageous Journeys here at CentralValleyTalk.com. We'll see you next time. Thank you so much, Dr. Delalas.
You're quite
CentralValleyTalk.com